What's up?
So initially, left ventricle push blood into the aorta, and from aorta blood is going into the splenic artery that supply blood to the spleen. And also from aorta, blood is going into the mesenteric arteries that supply blood to the intestine. In the intestine, blood reach intestinal capillaries. Intestinal capillaries have pores. Through these pores, fluid exchange occurs between intestine and the circulation. To explain this, recall that cardiovascular system is a closed system, where fluid exchange occurs in capillaries because capillaries have pores. So we have afferent vessel that delivers blood to capillaries, we have efferent vessel that provide outflow blood from capillaries, and we have capillaries that have pores. Through these pores in capillaries, fluid with nutrients can enter into the interstitial space. From the interstitium, cells that compose a particular tissue receive vital substances. But some portion of fluid after this usually remains in the interstitium, and then lymphatic system drains the excess fluid from the interstitial space into the venous system. The amount of fluid that crosses capillaries and enters to the interstitium depends on filtration rate, and filtration rate is described by Starling equation. Filtration rate is equal to hydrostatic pressure difference between capillaries and interstitium minus oncotic pressure difference between capillary and interstitium, and directly proportional to hydraulic conductivity. It's a simplified version of equation because values as oncotic reflection coefficient and surface area usually are constant, so they are determined mostly by the properties of a particular tissue. First of all, we see that hydrostatic pressure difference is the main driving force that pushes fluid out of the capillary. Oncotic pressure difference is the force that keeps fluid inside the capillary, and hydraulic conductivity in fact just describes how permeable is the membrane. So by this principle, fluid exchange occurs.
How do you know all that?
So it's a general concept that can be applied to every tissue. In case of intestine, mesenteric arteries delivers blood to capillaries, mesenteric veins provide outflow blood from capillaries, and cells that compose interstitial tissue called enterocytes. Then blood from the spleen by splenic vein and from the intestine by mesenteric veins is delivered to portal vein. Portal vein drains blood into the liver, where in liver capillaries that we call sinusoids, fluid exchange occurs. The principle is the same. The difference is that in case of liver tissue, the vessel that delivers blood to capillaries is portal vein, liver capillaries also called sinusoids, and the vessel that provides outflow blood from capillaries is hepatic vein, and cells that compose liver tissue called hepatocytes. After fluid exchange in capillaries, blood is going to the hepatic vein, and from hepatic vein, blood is drained to the inferior vena cava. But also we have to know that in this system we have additional vessels that remain from embryogenesis. Such vessels we call portosystemic collateral blood vessels. Back in times of embryogenesis, these vessels were crucial. They provided flow to esophageal and gastric veins. Also, they provided flow to paraumbilical and superficial epigastric veins that are located on anterior abdominal wall, and also they provided flow to upper anal canal veins, and from these veins blood is drained into the inferior vena cava. From inferior vena cava, blood goes into the right atrium and right ventricle of the heart, then blood crosses pulmonary circulation and goes into the left atrium and left ventricle, and from left ventricle, heart again pushes blood into the aorta, so this cycle can be repeated over and over again.
Are you actually believing this crap?
But the problem with portosystemic collateral vessels is that we use them just in embryogenesis, because adult person has this great portal vein pumpline that delivers blood from portal vein to inferior vena cava as fast as possible. But what is the reason that makes portal vein pumpline so good and portosystemic collateral vessels so useless?
I have a science question.
It's 10 o'clock on Saturday.
To explain this, we have to recall that blood flow in cardiovascular system is equal to pressure difference divided on resistance. So in this case, both portal vein pumpline and portosystemic collateral vessels deliver blood from portal vein to inferior vena cava. As you know, all roads lead to Rome. So pressure difference will be the same, and in both cases will be equal to hydrostatic pressure inside the portal vein minus hydrostatic pressure inside the inferior vena cava. But as we see, the destination is the same, but the roads are different. Each road has its own resistance, and as we know, resistance is inversely proportional to the force power of radius. Resistance is the force that opposes to flow, and the major factor that determines resistance is radius of the vessel.
What is this for?
Fun?
So the concept here is that the major reason why we use portal vein pumpline as the major pathway is that the vessels that compose portal vein pumpline have huge radius. Huge radius gives them low resistance. Low resistance creates a greater flow. Because in contrast to portal vein pumpline, portosystemic collateral vessels have very small radius. Small radius gives them a high resistance. High resistance creates a low flow. And as we know, fluid is electricity. It passes through all possible roads whether the resistance is high or low, but the difference is that the fluid prefers the most comfortable road, with lowest resistance. So the flow is greater in the vessel with lowest resistance, so fluid goes primarily into the vessel with the biggest radius, because such vessel has minimal resistance.
Did you understand a single word of what he just said?
So in normal condition, because portal vein pumpline has very low resistance and collateral vessels have very high resistance, practically all volume of fluid goes into the portal vein pumpline. So the amount of fluid that is located in collateral vessels is minimal.
You didn't know that?
Seriously?
Am I done here?
Son of a bitch, you're really no help at all, you know that?
Hey, language!
For example, let's suppose that resistance in portosystemic collateral vessels is 99 times greater than in portal vein pumpline. So in this case, from 1000 milliliters of blood that comes to the portal vein, 990 milliliters goes into the portal vein pumpline, and only 10 milliliters going into the portosystemic collateral vessels. So as you see, in normal condition we practically do not use them. But it turns out that these vessels are of vital importance for us, because in case of emergency, as in case of portal hypertension, they provide decompression of portal circulation.
Great. Fine. Yep.
Ciao. What's that mean? Ciao. It's Italian. Means food.